today we have a very interesting session on the Netherlands. So how the vendors apply IHE profile at national level to share patient summary across hospital use case, sorry, from the Netherlands. So we'll have 3 speakers that you already see here. The first one will be Vincent Van Den Berg, who is the IHE Netherlands co-chair and also digital health innovator at Chipsoft. So I think, Vincent, you can start. I will leave the sharing screen to you.
Yes, thank you very much. I'll share my screen and switch to the presentation. Thank you very much all for joining this webinar, viewing it on a later time when it's convenient for yourself. Today we'd like to show you a use case in the Netherlands from IHE profiles, and I'm doing that not alone. I'm doing that with together with the colleagues Sophia just announced. So my name is Vincent Van Den Berg, digital health innovator at Chipsoft, and Chipsoft is a EHR vendor in the Netherlands. In fact, it's the market leader specialized on hospitals, but also on other markets. And since recent, I'm the vendor co-chair at IHE the Netherlands. When I'm the follow-up of IHE. We did it for a long time and it's well known in the IHE circuit. And together with my colleague at Chipsoft, Jasper Van der Zwaag, who is interoperability data exchange consultant at Chipsoft, and Koen Arnoldus, interoperability success lead in the Netherlands at Epic, which is of course a global big player and market leader at EHR systems. So we're very happy to announce this showcase. If you have any questions, feel free to ask. We have enough time at the end to do the question, but if you think it's very useful to have your question during the webinar, please feel free. First, a little introduction, and then afterwards in the agenda, there's the specific collaboration of Chipsoft and Epic, of course, also some future opportunities. And we'd like to look a step further in the future of data exchange in the Netherlands. And then we have hopefully enough time for the Q&A and discussion session. So first, a little introduction out of IHE perspective in the Netherlands. And I'm very happy to announce you all that we have a new board in the Netherlands at IHE. And a new board was settled at the end of next year or previous year. And with the new board, we had a lot of sessions, and now we also have a new vision, which we call proudly copied from. And some people know this term, and the reason why we choose for this term is IHE in the Netherlands is connected to all the other IHE parties in the world. But we think it's very important to focus also in the Netherlands and use the IHE methodology in the Netherlands and use the IHE profiles in the Netherlands too. So we call it proudly copied, like comply or explain what's internationally successful. The members of a new board, on the left side, it's me, and next to me it's Evert Sanders, who's a long-time co-user chair. And next to Evert on the right side is Wim de Koning, who is a vice vendor co-chair. So we're doing this job together. And next to Wim, there's Robert Breas. A lot of people know him from the scholarships in the Netherlands and also Connectathons. And he's our treasurer. So a little in-depth about that strategy. First, in 2024, we'd like to focus on adoption of the IHE methodology, so specifying, testing, the cooperation of users and vendors. Then we like to focus more and more on Dutch implementations in 2025, for example, imaging, patient summaries, and 2026. We strive to a more integral approach. So every specification in the Netherlands should be on one place and all the dots should be connected, and IHE can play a part in that ecosystem. A little more in detail on that vision, we'd like to show you that we say think global, act national, because the Netherlands, it's a small country, so you can act local, but national is local too. And the Dutch community building is very important for us. We'd like to have more and more a broader community, and we are going to cooperate more and more with ASL7 in the Netherlands. And from marketing perspective, we also have a vision that nowadays it's focused too much only on XDS as people see IHE, and we'd like to more people to know that IHE is far more than only XDS. We do that, of course, also with a lot of education. So we have an education system we call IHE Academy, which we want to use more. And of course, several events like the Connectathon and the HL7 workgroup meetings where we attend to, and we have a lot of Dutch meetings, governmental, non-governmental, and we want to be everywhere so we can be complementary in the part of the system. Then a little bit more about Epic and Chipsoft and how we apply it. So it's important. Today we show a little bit about the awareness of the IHE methodology and applying it. It's important everyone knows that you have a user part and a vendor part, and that co-creation, cooperation, that's very important in the methodology. Also a big item in the Netherlands is our National Test and Validation Center, which is IHE inspired, and we're at the beginning of building this center, and of course IHE Netherlands wants to participate in that project. Epic is also international member of IHE, and Chipsoft supplies the vendor co-chair in the Netherlands. So this is a little bit of introduction about IHE in the Netherlands. And now I'd like to give the floor to Jasper Van der Zwaag for the next part, the collaboration between Chipsoft and Epic.
Yes, thank you, Vincent, for the introduction. So I'm going to share some quick background about the collaboration we started with Epic in 2017, actually the collaboration between Epic and Chipsoft. So if you continue to the next slide, Vincent, I'm going to show a short map first of where the collaboration started. So we started the collaboration in the northern part of the Netherlands called Friesland. I've included this small map because not everyone might be sure where Friesland is in the Netherlands. So we started with 2 hospitals, and if you click a couple times, Vincent will show those hospitals as well. So in 2017, we started with 2 hospitals in those regions. First, the Medisch Centrum Leeuwarden, a hospital which works with the Epic software, and the Jonge Schans ziekenhuis in Heerenveen, which works with the software from Chipsoft. And it's important to know that while Chipsoft is our company name, HIGS is actually the software that is used to provide that we provide to the hospitals. In terms of scale, it might be relevant to know that the region of Friesland has about 700,000 inhabitants, so it's not densely populated, but still there's about 7-8 medical institutions that provide care to patients. And MCL is the bigger hospital. It has around 650 beds, which is even for Dutch standards, it's quite a big hospital. And the Jonge Schans hospital is a bit smaller. It's around 300 hospitals, so half the size of MCL. But well, collaboration was definitely necessary because there was a lot of patient exchange between those hospitals. And I'm going to expand on that collaboration in the next slide. So in terms of practical impact, what was the ambition in the cooperation between the 2 hospitals? Well, the main reason was that there was an urgency to collaborate on several topics. There were several use cases that were interesting and that required data exchange between those hospitals. So MCL required information from the Jonge Schans ziekenhuis, but also Jonge Schans required information from the MCL hospital. Though that information was simply required to provide accurate care to the patients. Except on top of the basic information, sometimes there was also the case that patients need to be referred. And also the referring process was from MCL hospital to Jongersgans, but also from Jongersgans hospital back to MCL was relevant. So that's something we eventually also included in the scope of this collaboration. Also, another principle that was important in this collaboration was that we didn't want to burden the patient and the professional with additional administrative load, because we already realized that there's a lot of administrative load coming towards those healthcare professionals and also patients sometimes. So we wanted to keep it as clear and simple as possible, but really started collaboration. And another principle that we really wanted to include was the use of proven international standards as much as possible. That's important in terms of upscaling internationally, but also upscaling nationally. We thought it was important to include. So if you continue, Vincent, I'm going to elaborate a bit more on what we actually realized in the period starting from 2017, 2018. It actually started in with one stage which was really focused on the viewing part. So to not burden the healthcare professionals too much with changing the work processes, we started with providing a view on both hospitals to provide the healthcare provider with the relevant data to actually be able to provide optimal care to patients. And we decided to do that because it was low-key, it was relatively easy, and it had limited impact on the work processes. So that's why we started with these processes, and that's why we made it stage one of the whole collaboration. Secondly, we included and we upscaled the scope towards also including the digital referring. So we started referring from MCL to Jongersgans and also back, including a standardized patient data set. So it's not like the IPS already, but it's a Dutch made patient-related summary. And next to that, we also included unstandardized documents because those were eventually very important in providing the healthcare. We also decided to include those documents into the referring process. Of course, the inclusion of the referral process also had impact on work processes. So that's why we made it stage 2. But it was important to facilitate, and eventually we have some happy end users who can really use this now. But before we go to the results, Koen is going to explain more about the more technical background of the stage 1 and stage 2 processes we made.
Thank you, Jasper. So when we started the project in 2018, we started by just learning about each other's architecture and where and how we can apply the various roles that we see typically in the IHE transactions. So some background first on what we do. Within EPIC, every organization around the world that uses our EMR forms their own XCA affinity domain. This allows them to connect with each other across the internet using a mutual TLS connection. And every installation, therefore, is their own registry, but also their own on-demand repository. They all have their own initiating and responding gateways in terms of IHE. And our client, called Hyperspace, will act as a consumer, where outside documents will appear within the patient's chart next to their local chart. Medicentrum Leeuwarden was already able to exchange documents with all the other EPIC organizations using EPIC. And then similarly, we saw that Chipsoft, although we're using a different model, their hospitals were also able to connect with each other using a HICS API platform. This is a centralized registry where all the hospitals form their own individual repositories. In the Chipsoft scenario, the HICS API platform will act as the initiating and responding gateway, and there the documents that they receive will also appear within their patient chart. So the goal of the project was to allow Medicentrum Leeuwarden and Jongersgans to query each other for documents using standards, and IHE provided the perfect toolbag to make the project work. This architecture also meant that Medicentrum Leeuwarden, on the left, would query the central component and would allow to give them access to more documents than just from Jongersgans, but also the other Chipsoft organizations. At the same time, we realized that the EPIC organizations, if they wanted to do something similar, they would have to set up their own connection with the X API platform, and they've done so since then. So what happens exactly in that centralized IHE-Europe? It's a fairly standardized three-step process in both directions. Initially, we start off with a very standardized XCPD or cross-gateway patient discovery process to see if there's a common identifier to address the patient. I'll zoom in a bit on this more on the next slide because we do have a centralized identifier in the country that we use for this purpose. Once we've established that the patient is known at the other end, we move on by asking what documents are available. The query response will contain the necessary metadata for the documents that we can pull, and is then used to notify the physician that there are external documents, and will also present them in a timeline to make it easier for them to pick and choose what documents they actually want to retrieve and view. When they then select the document, we trigger a cross-gateway retrieve transaction to then download the document. On the ChipSoft side, these are then pulled from one of the repositories, the repository from the source hospital, and within EPIC, they are then generated on demand at the request. All of this is done using mutual TLS secured connections across the internet and uses synchronous transactions. So if we zoom in a bit on the patient discovery process, within the Netherlands, we have a fairly strong national citizen ID called the BSN. Hospitals are actually required by law to register these numbers and to also verify them with the government using a standardized web service and validate them on top of that by an in-person check. Any communication between organizations must use this BSN number, but only when it's been validated. In addition, we also have legislation in place that requires a hospital to have consent on file from the patient that allows them to disclose these records. The XCPD responding gateways have been configured on both ends in such a way that no communication can take place if these requirements aren't met. As such, the patient discovery response will actually indicate that no patient was found in the case that either the BSN is unknown or not verified, or if the patient has not yet provided their consent. If we look at the actual documents that we exchange, like Jasper already mentioned, we started off with the use case for a Dutch patient summary called the BGZ, which is a CDA document. And since then, we've scaled it up to include more types of documents, including all of the relevant correspondence in PDF format, but also all the radiology reports in either PDF or CDA format. And we're testing various other documents at the moment between the hospitals. Now, with the pull workflow up and running around 2020, we started to investigate other options to exchange documents between these sites. And talking with the departments, there was a lot of interest in the option to refer patients using a push methodology. After reviewing the requirements and also looking at the existing support between EPIC and ChipSoft, we decided to use the XDR transaction, which can be used to register one or multiple documents in a set at the other registry. And there are a number of benefits with this workflow. First off, there's no consent required for these sorts of referral messages by Dutch legislation. Second, it can automatically then register the patient on the receiving side if that patient is not yet known, which is a huge benefit because often we saw that patients were being referred from Jongersgans to MCL for complicated surgeries, and they had simply never been to MCL before. And now the transaction can trigger a workflow to happen at MCL to schedule the surgery, for instance. And multiple letters and attachments are directly integrated in the workflow. It does, however, that the departments at both the hospitals have to reach an agreement on how to use this workflow. And both hospitals are currently still working on rolling this out to all the departments. It's currently live in about 10 of their specialties, the most commonly used ones, and they're slowly rolling it out. So with all of this in place, what have we actually accomplished since 2020? If we look at the number of records that we've exchanged specifically between MCL and Jongersgans, we're seeing that around 35,000 records have been exchanged in the last 4 years. And as you can see, we still see a growth in that number, which can be attributed to both the increased number of consents that we see at both organizations and the rollout of these referral workflows to more departments. Now, it's important to note that we're not just exchanging these records. With various other national initiatives, we've also added support on both ends to reconcile pieces of the documentation that we are exchanging, like allergies and problems, straight into the local chart that can then trigger various decision support tools for their physicians. However, like I mentioned, MCL isn't just querying Jongersgans. We are querying the centralized HICS API platform, and we are getting results from all of the connected ChipSoft hospitals. So if we look at the number of exchange records between MCL and in general all the other ChipSoft hospitals, we've seen that in 2023 alone, we've exchanged over 75,000 records, and we do expect that number to grow even further. At the moment, every hospital organization using Epic or ChipSoft is currently live with this connection or working on it very hard at the moment. But we do expect this to be up and running by the end of Q1 of this year at all the sites. So I'm giving it back to you, Jasper.
Yep, thank you. So let me share the screen right now. Hope that works. So thank you for also explaining the technical background, Koen. And it's good to know that you mentioned how many files we've already exchanged with these collaborations. And I think that provides a beautiful scenario for the future as well. So in terms of future opportunities, I'm going to discuss two parts. First, the opportunities we have in this collaboration to upscale it within the Netherlands, but also outside of the Netherlands. And in the chat, I already saw something about the European health data space. And of course, European collaboration is an important topic within the Netherlands as well, especially since we've had some collaboration wishes with also the Dutch and German market, but also the Dutch and German Belgian market, which is important. So in terms of the Netherlands, by working together already, there is a 90% coverage of those hospitals eventually able to include in this process. And that's actually a great step because there's about 60, 70 hospitals in the Netherlands that actually are providing those patient care. And by combining the joint efforts of ChipSoft and Nexus, we can help patients and hospitals in terms of receiving the right care. Also, we want to increase the use cases. So we've started with a couple of use cases in the MCL Jongersgans scenario. We want to include other software providers as well to upscale these connections and make sure the impact gets increased across other software providers and vendors as well, to include as many hospitals in the Netherlands as possible. Also, importantly, we want to work together on international standards because, of course, the Dutch patient summary is important, but including more international standards will provide more opportunities for upscaling within the Netherlands, but also in international sense. And that's important for European cooperation as well, because we see, especially with the European health data space coming up, that it's important to collaborate on those topics as well. So outside of the Netherlands, we in the Netherlands already are experiencing increased urgency to work more internationally. We have some hospitals that are close to the German region who are working with German patients as well, and German hospitals who are working with Dutch patients. And of course, also in the Belgian market, there's a wish to receive care from large Dutch hospitals, but also we see an outflow from Dutch patients to the Belgian market. So we think it's important to provide opportunities there as well. And with the collaboration between Epic and ChipSoft, that might be possible. So like I said, the European health data space is going to require international interoperability. So we're thinking about what standards we need to use already to provide opportunities for hospitals there. And the first step in that is focusing on aligning with the Dutch national contact point, which is already developed to a certain sense. We think it's important to include the Dutch national contact point as well in these discussions to make sure that international cooperation will eventually be possible. I'm going to be giving it back to Vincent.
Yes, thank you very much. Then I would like to show something about future of data exchange in the Netherlands and developments about that. But first, I want to express that I'm very happy that with this collaboration of EPIC and Chipsoft, approximately 90% of the Dutch hospitals are connected together based on IHE standards. So that's a very big step, and the technical base is there right now. So now we can go full blown for the transactions to help that patients. First, I'm going to the next slide. Yeah, about the future of data exchange in the Netherlands. With this topic, I should tell a little bit more also about patient exchange in the Netherlands, because there was a big program in the Netherlands, or it still is, where patients should get access to their own data. And in this program, we call MedMe, approximately, not every hospital in the Netherlands, every specialized center in the Netherlands, every general practitioner in the Netherlands has in some form a FHIR server, which the patient summaries or the specific resources can be extracted if the patient wants to get his own data. So that FHIR server, it's based on standard for trial use 3. So it is still the previous version of FHIR, but because that infrastructure is there of hospitals and general practitioners and other parties involved, we thought maybe we could use this also as a first step of the big rollout of FHIR in also transactions. So what did we do with different vendors? We thought, what should we do if we want that referral process to be supported? And we have a simple concept, like if you can pull all the data and you can just send a notification to another, then the other one, which you send a referral to, can pull the data which is necessary in a caregiver to caregiver transaction. So that's what we call the notify pull interaction mechanism for a referral. And we did it together in the Dutch cooperation between different vendors. And the program was supported by Twin. And Twin, you can see a bit of the same like the Dutch way of the trusted exchange framework in common agreement. It's a bit inspired by TEFCA USA. So it's what we did was a technical agreement about how to use that FHIR resource in a notified pool scenario to do a referral. And Twin supported this project. So we have a Dutch agreement about how can we use this. I'll tell a little bit more about that, not going too much into detail. So I showed the most simple graph of this. So what's the way this interaction works? As a sender, you can ask a token at the receiving organization you trust. The receiving organization gives you a token, you can create a notification task. And then whenever that receiving organization or person wants, it can pull the resources. So the resources, it can be a FHIR task combined with different resources, or it can be the patient summary or other stuff. And in the pull scenario, it's not in this graph, but there's also some workflow possibilities, like canceling a transaction. And if you want to know more about this, you can visit this website to be inspired by this Dutch agreement. As I said, this is the Dutch protocol or agreement we use right now, based on standards for trial use 3. But of course, we're also looking a bit further. So since recently, the FHIR R4 profile, the IHE profile, sharing an IPS, is available, version 1, and it has different scenarios for publishing an IPS or an on-demand access to an IPS, retrieving an IPS, or pushing it to a recipient. And we think this IHE profile can be adapted for different scenarios. So not only the international patient summary, for example, the European patient summary, but also different summaries we know in the Netherlands. So for a lot of transactions, we think this IHE profile can help us. And of course, we started in the HL7 community a little discussion about fire notification and how can we use that in an optimal way in the Fire R4 standard. So there's the discussion going on right now to maybe use the fire subscription and notification mechanism. And the next step is, of course, maybe we can use that and adapt it in the IHE profile in the newer version for a notified pool scenario for sharing a patient summary with someone else. This is a short stuff about the developments in the Netherlands, and we'd like to cooperate with different countries, of course, to bring this a step further. So for people who are interested, the sharing IPS profile you can find on the IHE International website, the ITI profiles, and there you can see here it's the version 1 based on Fire R4. Then we have enough time, I think, yeah, for the Q&A and a discussion session. So I didn't look in the chat right now, but maybe there are some questions, or maybe someone would like to speak up to have a discussion or a Q&A. I'll stop sharing my screen so we can see each other.
Andreas Klinger has a question on how are the costs shared between the hospitals? Is there reimbursement from the government for such setups?
Yeah, that's thank you for the question. There's a subsidized program in the Netherlands which has come to an end recently, and that's one of the drivers for this project. But in advance of that project, we already started, as Jasper told us, because there was a practical need, and of course we'd like to use standards for fulfilling this practical need. So it's like a step up from the real world scenario. Then for scaling up, this subsidy program is really helpful because not only for the money, but also for the priority on all those hospitals to come in a scale-up situation. And right now we're in the phase that this is becoming law in the Netherlands. So in about approximately 1.5 years, it is not legal anymore to refer a patient without giving the electronic information to the other one. So that will, of course, help very much for real scale up also with other parties involved than only the hospitals.
Thank you, Vincent. We have another question, but please note your mic has been disabled. You can raise your hand and speak up yourself, but you will have to unmute yourself on top. But meanwhile, we have a question. What are the thoughts on image sharing? From Rick Bushbridge.
Yes, so maybe we have another webinar on that topic about image sharing in the Netherlands, but we have enough time, so let's try a little bit of it. There's like a hybrid scenario right now in the Netherlands. There's a program, a specific program, which is being used by a lot of hospitals to share imaging. So it's a portal, and you can share imaging in that portal, and other ones are using that portal, and they can pull the image out of it or view it. But that's more like a product approach. And of course, we'd like to use standards. So that product is being used right now for the push scenario. When you refer a patient, you can push the images to the other one. But before that product was started, there was also a XDS infrastructure in different regions in the Netherlands. They had already invested in an XDS infrastructure. So vendors are working together, trying to connect those infrastructures. And that's important, of course, because like I said, the Netherlands is a small country, so you can see it as one region. So in one way, all those XDS regions are trying to connect together and work together so you can have a nice workflow as an end user. And on the other way, there was a program like a portal, which was for free. So there was a bit of a hybrid scenario. And in the COVID period, everyone was using those the free portal, and it is a successful product right now. And now we're at a tipping point. Because we want to look further, and with the same law in the Netherlands, it will also be illegal to not share any imaging digitally. So now we're at a tipping point. What do? Are we going to develop that portal, or are we going to work with standards? And of course, I think you can guess what the opinion of IHE, the Netherlands, is in this topic. But we're designing right now a technical agreement. How to get there? What's the right base, standard based, for also a pull scenario, a push scenario based on IHE profiles, based on XDS platforms, based on FHIR, based on also a hybrid scenario for streaming imaging. So we're working on a very good technical agreement right now, but we need some time for implementing it. So we think that's the solution for this problem. We have a little bit more time for those implementing the technical scenario, the technical agreement. And meanwhile, we will still use that product, and maybe also for some pool scenarios. So hopefully this little short webinar did answer the question.
Thank you, Vincent. No, I'm very pleased to hear that. We'll probably see each other soon, I guess, because I'm working at NICTIS now, and I'm just trying to find the scope of things. So thank you very much for your feedback. I appreciate it very much.
Thank you for the question.
We have another interesting question. How are Chipsoft and Epic looking at these new FHIR initiatives? As Notify Pool is not implemented yet, as far as I know, and maybe only used in the Netherlands. Maybe
Koen, Igor, could you elaborate a bit on what new FHIR initiatives specifically you're talking about? Because there are a lot, obviously.
You can unmute yourself, Igor.
Yeah, well, I understand that the BGZ Notify Pool is not implemented yet in Epic, and I wonder, there is a lot of sharing already possible with Care Everywhere. You show it just with a lot of nice XDS profiles, of EIA profiles. And now the Dutch government say, okay, you must exchange by Notify Pool FHIR, almost the same data. So I was wondering how you as company look at that approach, and not only for you, but also for Chipsoft.
No, it's definitely an interesting time at the moment, where there are a lot of discussions happening on all sorts of levels. And we are trying to participate where we can in these discussions to make sure that whatever new technical agreement or agreement we come up with as a country doesn't hinder what we've already accomplished. So it should not be the case that we stop this project because we need to switch to FHIR, unless the FHIR solution is at least equal in functionality as what we have accomplished at the moment. So we are trying to contribute to the meetings. We're trying to contribute to the discussions with our expertise and experience, also from other countries. But it is there's a lot in progress at the moment, and there are a lot of draft agreements that we need to look at.
And Koen, if I may ask, because we are Netherlands, we are a very small country, and for Chipsoft, this with Belgium only the only market. But for you, you are worldwide. Is this a kind of interesting, or do you just do it for the Netherlands, or do you see this going all in the other countries in where you work? Is this something only for us, or?
Some things are Netherlands specific, some things are not. You're right that we are active in more European and other countries around the world. For instance, but in Denmark and Finland are often referred to as examples. Those are just very different countries in the way that they've set up their healthcare system. Even though we are a very small country, we're also a very fragmented country in terms of number of healthcare organizations. So hence we need a lot of exchange to happen between all of these parties that require very specific data sets and very specific standards to be used. So some of that is Netherlands specific in a way, or a problem that we created with ourselves. And then when we look at the United States, I believe it was Vincent who mentioned TEFCA. That is something, for instance, that we are participating in. And TEFCA is a project initiated by the government in the United States where it allows vendors and different parties to connect with each other more easily. And it is very similar to, well, Twin, or I should say Twin is inspired by TEFCA perhaps. So we do definitely see some parallels between countries. Yeah.
Okay, thank you.
Vincent, do you want to talk about the position of Chipsoft on this question? Because it was Koen who from Epic who replied.
Yeah, I can add something on it, but I fully agree with what Koen said. It's important to use whatever is available and not only jump to the next hype and then forget what is already available, and especially when it's standard based. So for Chipsoft, we are working on the technical agreement right now, and we are going to test that next week with together with the tooling, which is in the startup phase of that National Test and Validation Center. So we're getting hands-on experience with that technical agreement, and it is for us especially focused on other vendors. Like I said, because of that patient program, a lot of FHIR resources in the trial use version are available, and we'd like to also connect with systems who can share that data on the FHIR STU3 base. So we see it as an add-on, additional learning, having a Dutch agreement, bring it in international, and working together to make that eventually an international standard, or add it to the international standards, and also adopt international standards.
Okay, thank you.
We have another question from Robert Segwe. Would such a technical agreement be published also as a volume 4 to the IHE profiles? And if this is the case, which profiles? Anyone being a candidate to reply?
Yeah, that's interesting. I think it's a bit early right now because of what we the first action we did from the Netherlands, and it's also combined with NICTOS, the standardization organization in the Netherlands, is bringing in that design into the HL7 community to start up the discussion about how to use that notification mechanism. And once we have experience with the technical agreement in the Netherlands, and we parallel have that discussion about how to develop the technical agreement, we afterwards that we can make the step how to implement it in the IHE profiles, which use the international standards. And then, of course, it should be nice to add it on to the international IHE profiles, and otherwise it can be a Dutch extension, for example, meanwhile. Does that answer the question?
Anything that we can promote from a national level to an international level is definitely something that we try to do, if only to prevent other countries from inventing another wheel or a different wheel for the same use case.
Andreas, I think you would like to add something.
Yeah,
you can unmute.
And indeed, thanks. To my understanding, there is no base profile for this notified pull mechanism, so which makes in this sense then there's also no way to add this to volume 4, because volume 4 is of course only meant to further profile existing profiles from IHE. So the first thing which would have to be done is create a generic profile which could then be adapted further for the Netherlands case in volume 4. But I'm not sure if there's really at the moment any activities of looking into that, especially like having this based on R4 still. I wouldn't expect that there would be some activity on the IHE level to do an IHE profile based on that. The question would also be, what would an IHE profile actually add besides the testing concepts, of course, which is very valuable and a common structure for these things. But I guess that's a little bit a general problem at the moment on the existing fire or IHE profiles which are based on fire, how to fit such kind of things in, and what is the added value there.
Robert?
Yeah, well, I was kind of thinking myself on having this as an extension to the SIPS profile, because it is kind of our way to actually communicate the IPS or the Dutch patient summary. So I was just thinking whether that would introducing a notified pull scenario into the SIPS would be something worth considering.
Yeah, that's the way I interpreted the question, like an extension on the sharing IPS profile.
Yeah.
And I think it's a bit too early right now, and
sure,
we have some experience discussions, and then we can maybe add it on to that as an extension.
Great, thanks.
Thank you, Andreas and Robert. Anyone else having a question? If nothing comes up, then we can close this webinar. Thank you so much, IHE Netherlands, Epic Chipsoft, Vincent and Koen and Jasper, and Cliff also for bringing this valuable information to us. And we hope to meet soon, at least in Trieste in June, I think. And don't hesitate to register for the next webinar on the 8th of March. We have key insights and industry opportunities on the European project linked to the IHE-XF. So there is really a different twist here on this webinar. So to all the people from the industry, the vendors, make sure that you join us. Thank you. Have a good afternoon and a nice weekend, and we hope to talk to you soon. Bye-bye.